Seasonal allergies may be difficult to control even when you're not pregnant, but when you're pregnant, and sniffling, sneezing, and itching all over, staying on top of your allergy symptoms feels like a huge effort. You don't want to take anything that may hurt your kid, but you also don't want to spend any more days in an allergy-induced fog. What medications are okay to use while pregnant for allergies, and which are not? Here's a rundown of your choices. What allergy medications are safe? Fortunately, there are more allergy medicines that are safe to use than not, so you don't have to suffer with horrible allergy symptoms just because you're pregnant. According to Obgyn Danielle Jones, MD, of Mama Dr. Jones, several over-the-counter antihistamine medicines and nasal steroid sprays are safe to use during pregnancy. Most of the allergy medicines described above will have minimal effect on the pregnancy, and have the same risk and benefit profile for the individual taking it as if they were not pregnant, says Dr. Jones. Choosing an allergy medication. Once you've determined which drugs are safe to use, you'll need to choose which one will work best for you. If your allergies are persistent or environmental, such as mold or pet dander, you should look for an antihistamine that you can take every day, such as Claritin or Zyrtec. Seasonal allergies can also be treated in this manner, but if your symptoms are uncommon, Benadryl is a fantastic, extremely safe option. If you have sinus discomfort or pressure as a result of allergies, one of the nasal steroid sprays may be a possibility. Because of an increase in fluid and blood volume, which may cause swelling everywhere, not just in your ankles, pregnant women frequently end up with extra nasal congestion. A nasal steroid can help reduce some of these additional symptoms. Allergy medications to avoid. While most antihistamines are safe to use while pregnant, certain additional medicines often used to treat allergy symptoms may not be. Expectant mothers should be cautious of allergy formulations that contain other chemicals that are harmful for pregnant women, such as aspirin or other NSAIDs, as well as some cough suppressants or expectorants. You should also avoid allergy medicines that contain decongestants, like pseudoephedrine, Sudafed, unless your doctor or midwife has cleared it, according to Dr. Jones. Although decongestants are unlikely to harm the fetus, they can induce a rise in blood pressure in certain people, Dr. Jones adds. Some evidence suggests that pseudoephedrine may be related with a slightly increased risk of birth defects. However, these potential concerns have only been detected during the first trimester. As a result, Sudafed may be a limited-use choice for women in their second and third trimesters who do not have a history of hypertension, but only if your doctor approves. How to reduce your symptoms while pregnant. Unfortunately, avoiding your triggers is one of the greatest methods to decrease allergy symptoms, but this is frequently easier said than done. During ragweed season, you can't just stay inside your house. According to Dr. Jones, there are a few alternate treatments for reducing your exposure to allergens. You can do the following. Keep hydrated. Irrigate your nose with saline. Instead of leaving the windows open, use air conditioning in your car and at home. To eliminate allergies and pollutants from the air, use a humidifier. After spending time outside or being exposed to allergy triggers, change your clothing. Of course, if you're still experiencing allergy problems, you should seek professional assistance. Don't be afraid to discuss your symptoms with your doctor or midwife and seek their professional opinion on what may be done, advises Dr. Jones.